Bladder 27 is level with the first sacral foramen, 1.5 cm lateral to the posterior midline. Bladder 30 is level with the fourth sacral foramen, 1.5 cm lateral to the posterior midline.
Small intestine 11 is found at the junction of the upper third and lower 2/3 of a line joining the midpoint of the inferior border of the spine of the scapula and the inferior angle of the scapula. It roughly makes an equilateral triangle with small intestine 9 and small intestine 10, but this is not always accurate. To find small intestine 11 accurately, you first need to identify all of these landmarks. To find the medial border of the spine of the scapula, place your hand on the back where you think the medial border might be. If it's not palpable, a slight amount of pressure on the shoulder will help to bring the medial aspect of the scapula into relief. To find the lateral extremity of the spine of the scapula, palpate along the spine until you find a bump at its end. Be careful not to go completely to the end of the shoulder. This is the end of the acromion process. It's not the end of the spine of the scapula. To find the inferior angle of the scapula, palpate down the medial border until you can find the scapula changing direction at its bottom. Once again, if this is not palpable, it may help for the person to put their arm behind their back. This will bring the angle, the inferior angle of the scapula, into relief. It's important to remember that once you've located it, you need to keep your finger on it as the person moves their hand back. Small intestine 10 is located on the posterior aspect of the shoulder. It's directly superior to the posterior axillary crease and inferior to the lateral extremity of the spine of the scapula. Find small intestine 9, come straight up, feel for the spine of the scapula, and then come back down into a nice dip to find this point. You're not on the bone and you're not on the deltoid, you're in a nice dip. It's important to remember that to find this point accurately, you need to be standing parallel to the part of the body that you're working on.
Stomach 22 is 2 cm lateral to the midline, at the level of ren 11, which is 3 cm superior to the centre of the umbilicus. Stomach 23 is 2 cm lateral to the midline and 2 cm superior to the centre of the umbilicus, at the level of ren. Stomach 25 is 2 cm lateral to the midline at the centre of the umbilicus. Stomach 26 is on the lower abdomen, level with ren 7, which is 4 cm superior to the pubic bone, 2 cm lateral to the midline. Ren 5 is on the lower abdomen on the midline, 3 cm superior to symphysis pubis. Ren 8 is in the centre of the umbilicus.
Sanjiao 6 is located 3 cm proximal to Sanjiao 4. It's in between the radius and the ulna, and it's on the radial side of the tendon of extensor digitorum communis. Wiggling the fingers will bring this tendon into relief.
Pericardium 6 is on the flexor aspect of the forearm. It's 2 cm proximal from pericardium 7, and it's in between the two tendons palmaris longus and flexor carpal radialis.
Small intestine 4 is on the ulnar aspect of the hand in this nice depression between the base of the fifth metacarpal and the triquetral bone, which is this palpable bone on the ulnar aspect of the wrist. Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella. Bladder 57 is located on the posterior midline of the lower leg in a depression inferior to the two bellies of the gastrocnemius muscle. To find this depression, have the person point their foot. If you can't see the depression, palpate round, feel the bellies of the gastrocnemius and the Achilles tendon and spiral round until you can find a nice dip. This point is often described as being 8 cm superior to the lateral malleolus, that is halfway up the length of the lower leg. It's not always there. Please go with a local anatomy to make sure you find this point correctly.